So when we examine the knee, if you get a patient, so you are seeing some swelling in the knee, you should first check the history of the patient, whether it's a traumatic or a non-traumatic event. If it's a traumatic, obviously you should know the mechanism. You should ask them how it happened, get to know what is the mechanism that caused this injury. And if you are seeing any discoloration or any bruising, then you can suspect there is some chondral bruising, that is a cartilage injury may have happened, or it can be some ligamental injury. Again, meniscus injury also cause swelling. Again, swelling. In case of ACL injury, it will be like within a short span of time, there's too much of swelling. In case of meniscus, the swelling is comparatively very less progress. And deformity, there's deformity, varus deformity, valgus deformity. So you have to see any deformities are there in the knee, because if there's a valgus deformity, obviously there's a compensation in the hip. So you have to check the patient's hip. Any rotations are there, you have to check. Any muscle wasting, quadriceps wasting. Again, one interesting question I just wanted to ask you. Uh, the one of the most commonest exercise we give for knee is isometric quads exercise, right? Isometrics. And can you tell me for which muscles are we giving this exercise? And what is the purpose of giving this exercise to the patient? What is the okay? You tell me which muscle and what is the purpose of giving. You will say it is for strengthening the muscle. Okay. Let me see everyone's answers. So I said it's an isometric exercise of quadriceps. Right? The muscle is not VMO. The muscle, the concept is we are going to provide isometrics of articularis genu. That is the name of the muscle, which is called the fifth muscle in the quadriceps group, which is underneath the other quadriceps muscle. And the major function of this articularis genu is it is inserted to the patella, and this will help to flush out the swelling in the suprapatellar bursa. To flush out this swelling and to reduce the swelling, that is the reason this isometric exercise came for the knee patients. And we don't know why we are using this exercise, and we are using for all the cases. Believe me, that is a good exercise, but this is not meant for all conditions. In case of cartilage injuries, you should not use this exercise because this exercise cause compressive effect on the knee joint. So this compressive force will have a deteriorating effect if they have a chondral pathology. That is, if they have a cartilage pathology, this compressive force is going to uh, like deteriorate the condition. And there are cases where we don't have to use this exercise at all to improve. So this exercise again, I said the major use of this exercise is to flush out the suprapatellar bursal swelling, and that's what this exercise is meant for. And it is not meant for using in conditions of chondral pathology, obviously, and in cases where like in the some conditions of even post ACL surgery, because ACL the one of the major restraint for ACL is again quadriceps contraction. So in the initial phase, we will tell them to do the static, but it is an important exercise to prevent the inhibition of muscle, but it is not an important exercise for the joint. You should understand the isometric exercise of the quadriceps is good for the muscle, but it is not good for the joint. So you have to think wisely before prescribing this exercise. Makes sense. Examine the knee joint. Again, you should go for the pain assessment, whether this patient, how much severe it is, how much irritable the patient is, what is the nature of pain. These things you should check. You should check the range of motion. You should check the stability of joint. How you check the stability of the joint? How you will check the stability of the joint? There is test to check the stability of the joint. We will explain. Then there is a functional assessment, you can do the functional movement screening, squat, normal functional activities we can do, and there are some special tests. So again, when you get a case of knee pain, try to understand what happened and what is the structure affected and why this structure caused the pain. In the case of osteoarthritis, we already discussed the pain can be more or pain can be minimal, but that depends, that doesn't affect the articular pathology. So we have to find the root cause of the pain. See, in the osteoarthritis, again, the pressure is caused by the intra-articular pressure. That is, articular cartilage is damaged, and because of that, there is more of pressure within the joint. And that pressure is stimulating the pain nerve endings. So, if you are providing techniques or treatments to reduce the compressive stress on the knee joint, the patient will improve. But if you are providing only isometrics, then the patient will not improve. So, you have to find the exact cause rather than diagnosing the patient as OA and giving them a structured exercise of what you are giving to everyone. That doesn't work with all patients.